Hello and a very warm welcome to our YouTube channel. My name is Maria and I am delighted to be joined by Aya for the second video in our series on homeopathy. Aya, a very warm welcome. Thank you so much for coming back to join us again.
Thank you for having me again.
I'm so glad that we are able to continue the conversation. I know I learned so much from you on our last conversation. And so if you haven't seen that video, I would highly suggest that you go back, look at that video where we talked about homeopathy in pregnancy and birth. Aya gave us so much information and it is really worth checking that out. So today we are going to be talking about homeopathy in the postpartum period. It's such a big topic, we wanted to give it its own dedicated video. And so I want to make sure that everybody is first and foremost aware a little bit about you if they haven't seen the other videos. So can you give us a very quick introduction to who you are as a homeopath, Aya?
Yes, sure. So my name is Aya Brahim. I'm a registered homeopath. I've been practicing for almost 5 years now. And basically my specialty is women and children health. I help mothers and kids to find back their center, their balance. I can treat wide range of different conditions, whether it's starting from infancy, developments, and cold and flus or behavioral stuff for kids, and as well as mothers, general health, autoimmune, digestive, hormonal imbalances, anything related to the mother health, basically.
Excellent, excellent. All right, so when someone has had their baby, they're obviously going through a huge number of changes on every single level. So why would someone look at homeopathy in the postpartum period?
Yeah, so basically for two reasons. The first reason that we mentioned in the last video, that how homeopathy is very safe, it's very gentle, and it's a good tool to use. It's a good tool to have and to use during postpartum. And the second aspect is the depth of homeopathy. The remedies are really deep. They can really help the mother for whatever feelings or struggles she's having or experiencing, whether with the first baby or even with the third baby sometimes, when she thinks maybe whether the third was planned or not. But again, there is this aspect of tiredness and burnout. So remedies of homeopathy can truly help the mother, or like empower her to have a smooth postpartum, to get back to her routine in a quiet way, you know.
Wonderful. So we've discovered that homeopathy is safe right the way through pregnancy, through birth, and now you're saying that it's perfectly safe in postpartum, but that it's also a gentle support for somebody who might be having some challenges, which are, of course, all too common and very normal in the postpartum period. So going back to understanding more about the safety and the efficacy, is it commonplace for people to seek out homeopathy? Who are you regulated by? Who are you trained by? What is the training that you have to go through to call yourself a registered homeopath?
Okay, yes, that's a very good question. Thank you, Maria. Yeah, so yes, homeopathy is a regulated profession. There is a college, a CHO, College Homeopath Ontario. They assess us every year. We get renewed. Our license is renewed yearly based on assessments, based on number of hours, results with our patients. So the profession is regulated. It is supervised by a regulatory party or unit. And the good news is homeopathy now is involved in many private insurance companies. So
okay.
I know it's not covered with OHIP, and this is still a challenge for some people, but for everyone who has private insurance, actually the homeopathic consultation can be covered with private insurance. In terms of studies, as you told us, there are two main colleges in Toronto. One of them is called Ontario College of Homeopathic Medicine, and that's the one I graduated from. And the other college is called the Canadian College, Canadian Homeopathic College. So it's C and C. There's and both schools are very good, of course. It's a 3 to 4 years studies. It depends on the workload you need to do. Both of schools require clinical experience, so I can get regulated if I didn't did or have clinical experience with a certain number of cases, minimum number of cases, and with a minimum number of good results, or what we call cured cases. So we study everything: science, biochemistry, pathology, a lot of biology and medical topics, as well as, of course, a very deep dive into the homeopathic perspective and remedies. I can't tell you the number of remedies we study and the modalities of each remedies. And so yes, that's briefly, I can talk much more about that, but that's briefly how we study. We do it, part of it academically, part of it practical clinical experience. We go through an exam to be licensed, so we are regulated.
So we can say that, you know, from everything you've told us about the remedies, but also in terms of your training, that it is very legitimate, that it is above board, that it's a regulated profession, and that there wouldn't be, and I hate to use the word voodoo, but, you know, some people might not understand. And so that's what we want to do. We want to make sure that people can understand that there is alternative and complementary therapies out there that are available to you, and some have different efficacy rates, but that this is something that people can do quite safely. And again, like we stressed in our last conversation, that we would stress again that it is really important that if you are pregnant, if you are breastfeeding, or if you are in the early postpartum period, that we don't recognize or we don't recommend that you would self-diagnose or self-treat. You are far, far, far better and safer to work with somebody like Aya, who can make sure that you are taking the right remedies, because we want to make sure you're taking the exact remedy. Because I think I know enough now to say that different symptoms can present in different people, and so as a result you're going to need different remedies based on those specific presentations that you have, because my symptoms and your symptoms might appear to be the same, but obviously they're not going to be.
Yes, that's true. And I just had the thought, if you allow me to add, Maria, to prove kind of the safety or efficacy of homeopathic remedy. Now, over the counter, even in shoppers, you would find a wide good range of homeopathic medicine for kids in the cold and flu sections, like the brand that is called 0 to 9, the brand that is called Boiron, the brand that is called Orange. Those are actually homeopathic medicine sold over the counter in any normal pharmacy, like Shoppers or Superstore or Sobeys or all that places, just to give more credibility.
Wonderful. So the typical challenges that people will go through in postpartum range from exhaustion, baby blues, maybe going into postpartum depression, problems with bonding with their baby, feeling guilty because they're not spending enough time with their toddler because they're devoted to the baby, because the baby has colic or, you know, some sort of reflux or gas issues. So, you know, those are all very normal and very common. What types of issues do you see parents and patients presenting to you for? Are they those type of symptoms?
Yes, all of you mentioned, and even this past 2 years with COVID and the experience of first-time moms to deliver in the hospital on their own, that in itself was very distressful on one side. Or mothers who already have kids and they came back home with the baby in a lockdown, was a toddler or a preschooler, and then the house is a mess all the time. So the past 2 years, of course, has been challenging for any new mom, honestly. I've seen different stories. So as you said, the different issues were, big part of it was tiredness, fatigue, burnout. The point also you mentioned a lot is giving each child the adequate time that the mother wants. Like, you want to put the baby to nap so you can play with your toddler, but then the baby doesn't go to nap, so you feel like you can do both. The baby is napping, but you don't know, should you stay with your toddler or you should cook so that when the baby wakes up there is lunch or dinner for everyone. Those multitasking and time management and entertaining a toddler or preschooler while, or doing the online school on one side and the other baby is crying in the background. Yes, there are different issues. And of course, homeopathy can always help the mother, the baby, and even the toddler in the background.
So for any of those sort of concerns that people would have, the exhaustion, the burnout, the guilt, is there a variety of remedies that you would recommend, or are there the most frequent remedies that you would recommend? What's sort of the most common things that you are seeing people needing right at this moment?
So yes, of course, as you mentioned earlier, it really depends on each mother picture and emotions. I can just suggest few remedies as an example, just to show people that there is something that you can use, but it's a lot based on how the mother feels. And again, Maria, I'm sure you relate to that. The postpartum is also sometimes a manifestation to how we truly feel inside. If we had a childhood, I don't like to say the word trauma, the childhood story or incident. If I'm already mother, grew up thinking that I'm not doing enough generally, so in my postpartum, I will be feeling I'm not doing enough for my baby. If I'm a mother who is over efficient and over successful, and then with the chaos, things gets out of control. So with the baby at home, I will feel that things are out of control. So again, with postpartum prescribing, we have to go deep. We have to get to the root of why the mother is feeling this type of postpartum or reacting to the postpartum in that way.
Yes.
An example of a remedy would be natrium muriaticum, the cell salt, the sodium chloride, the ocean, the sea water. So that's a remedy known when there is a lot of sadness and a lot of grief and a lot of sensitivity, and the mother would feel like a little bit down and she's not happy. Whatever the different reasons could be, she's not happy. She's sad. She's not interested in having her daily life or routine. Another remedy is called ignatia. It's also great for grief, but this type of mother, she acts that everything is fine, everything is good, everything is under control for everyone outside. But then when she's on her own, she can feel all this inside sadness and grief, and it bottles up. Another remedy could be if the mother is feeling tired and burned out. It's a phosphoric acid, for example. There are many remedies. Sepia, again, it's a good remedy when the mother feels sometimes, as you said, indifferent a little bit to the kids and house and responsibilities, and she wants to do something else. So there are a lot of remedies. Again, I know you stressed on that, and allow me just to stress it again. Please don't self-prescribe. Don't say, oh, I feel that, so I will take that remedy, because as mentioned earlier, it's much deeper than that, and you will be having other symptoms next to your postpartum feeling that would direct any homeopath to prescribe a specific remedy. But
absolutely.
To be aware of what the mother is going, like as the mother, I need to be aware I'm in postpartum. I need to acknowledge the feelings. I guess that's the starting point.
Yes.
to acknowledge what I feel.
It's so important to acknowledge how you feel, because it's so easy to bury those feelings and pretend that they're not happening. But it is important to let them out. And I'm sure that very often you act as part counselor too, when people start to get things off their chest and explain how they're feeling. And I'm sure it makes them feel much better. But obviously then the real treatment comes with the remedies.
Yes, yes.
So one remedy that I'm particularly aware of is Arnica, and that is something that comes from the early postpartum period, and it's recommended generally for bruising following the labor and the birth of your baby. Can you explain a little bit about what Arnica is, how it works, and the various, because there's more than one way to take Arnica, correct?
Yes, that's true. Yes, so Arnica is a very good remedy for postpartum, as you said. So let's now clarify that the remedies we're talking about is for the physical postpartum help. So after any mother gets the baby, of course, there is pain, there is bruises, there is swelling. For some mothers, that you don't want to be touched anywhere near the area down there. Motion doesn't makes it better. So Arnica, it's a very good remedy that you can take with the white pellets. Just allow me to show you how the pellets are. Those are the type of pellets that we use. The mother can take them safely, again with the supervision of a homeopath throughout the day. So it helps a lot with all the swelling and bruising and discomfort related to the postpartum. And an indication for Arnica is they feel much worse when they sit on the bruised area, or like when there is pressure on the bruised area, or when they lie down on the bruised area, the pain is stronger. So Arnica is a good indication for that. And another remedy that helps when the pain is concentrated in the lower back area, it's polycarp. It's very good also for sore and bruised area related to back extending pain. So when your lower back, downward to your buttocks, downward to your hips and legs, this area could be very sensitive after labor, could be soring and bruising. That's another remedy called polycarp, and it helps a lot with the pain. On opposite to Arnica, heavy pressure relieves the pain. When you would find the mother like pressuring like that with her hands on her back, or pressuring on her hips or on her legs, pressure makes the pain better. So that's remedy is called polycarp. One remedy that I can suggest for contractions, especially contractions with breastfeeding, the relationship when once the baby starts to feed, the contraction starts, and it's very painful for mother, especially mother with cesarean too. So there's a remedy called colofalium. We also mentioned it last video. Colofalium helps a lot with the uterus contraction. So whether during labor or after labor in postpartum, it helps to regulate the contractions. It's like a painkiller for the uterus contraction while breastfeeding. It helps a lot.
Wonderful. And that can be a very intense pain, especially in the early days when baby is feeding and your uterus is really working to contract. It really can be very painful. So I think that's probably something people will be very interested in.
Yes.
And again, it would be remiss of me not to ask the question about, I know that, again, we're stressing you do this with the supervision of a homeopath, but is there any potential side effects or any contraindications as to why you maybe wouldn't take homeopathic remedies?
There won't be a counter effect. Like if someone takes a wrong remedy, it won't help. Again, because as I mentioned, you need to like finish all of that to have a real counter effect, and those are 60 pallets. I don't think anyone would take a 60 pallet on their own. So yes, the remedy, it either helps or it doesn't help. if it is a wrong remedy, unless you take a very long dosage of it.
Okay. So again, we can be confident in its safety as well as its efficacy when it's taken for the right reason.
Exactly. When the right remedy is prescribed with the right dosages. Exactly.
Wonderful. Wow, we have learned so much, and we still have more to talk about. So I look forward to our next set of conversations. I thank you so much for joining us. It has been an absolute pleasure to chat to you today.
Yes, same for me. Thank you so much, Maria. Thank you.
Thank you. I hope you have learned a lot from our conversation today. I know I have. And as always, I'm always so grateful to be able to do these conversations. I learn so much every time. We would love to know your comments. Did you use a homeopath? Were you able to get your hands on some effective remedies that were able to help you through the postpartum period? Because, you know, we're going to be honest and frank here. The postpartum period is not an easy period for any new parent. So, you know, go easy on yourself and know that the help and the support is out there. And if this is your first time watching our videos, a very warm welcome. And we encourage you to hit that subscribe button so that you can follow us along and join in our next videos. We try to bring you a video every Thursday. So stay tuned. So for the time being, it's goodbye from me and Aya, and we will be back very soon with our next video. Take care, everyone. Bye-bye.